Assalamualaikum everyone, welcome back to this channel. So this is me Alia Wahid, and in this video we are going to start the next half of chapter number 2 of pharmacology. So this is from the chapter number 2, and this is pharmacodynamics. So in this lecture we are going to see what is the relationship between a dose and its response. So now first of all, let's discuss that the drug response is depend upon how many factors. So here I have written here that your magnitude of drug response. What is drug response? That it is the a maximum kind of intracellular activity which is shown by your drug. Now this response depend upon the receptor sensitivity, that how much your receptor is sensitive about a particular drug. More the receptor sensitive, more the response you found. Next thing is it depends upon the number of receptors. More the receptors are present, there will be the more response. Next thing, it is depending upon the dose of your drug. So whenever you are increasing the dose of your drug, you are increasing the pharmacological response inside your body. So inside so as a relation, this relationship indicates that your dose and your response are directly proportional to each other. Whenever you increase the dose, your response will be increases. Lastly, it will depends upon the pharmacokinetics of your drug, that how your drugs is absorbed, how it is metabolized. So it's these factors are also affecting it. Now we are going to study this relationship between your dose of that drug and your response. So there are two types of relationship which we are going to study. The first relationship is the graded dose relationship, and the second relation is the quantal dose relationship. Now first of all, we are going to discuss the graded dose relationship. So here in the graded dose relationship, always remember it that graded word mean to increase, mean whenever you are increasing your dose, you are increasing your response. So let's suppose if you give a patient a drug of 50 mg, and other patient you have given a drug of 100 mg. So the patient which have more potency, which have more concentration of drug, has more response. So he will show quickly effective response than the other patient. Now I am going to draw a graph between the response and between the concentration of dose. So here the concentration of dose is written that like this is the 10 mg, 20 mg, 30 mg, 40, 50, 60. And here I have written the response from 0 to 100. So 100 is the maximum response and 50 is the half of this response. Now first of all, I am seeing this is the grade dose response curve. So this curve is usually helpful for finding the potency and for finding the efficacy of your drug. Now before studying these two terms, I want to explain all things about that curve. Now first of all, let's see, I have given a patient a drug A, and I'm going to see what kind of graded dose response curve will be obtained of that particular drug. Now as you can see here, I am drawing the graph. So I am increasing the dose. First I have gave the 10 mg, but now I have increased the dose. I am further increasing the dose. As you can see, the response is also increasing. Okay, on the 30 mg the response is above than the 50. Next I am increasing the dose further, and at last it will become straight out when it reach the 100%. When it reach the 100% of the response, it will straight out itself like this. Now as you can see, if I have increased the dose, the response also increasing. But at last, when it really reach the 100% of response, it will become straight, because here all the receptors are saturated. So therefore there is no receptor left, so there will be no response. So this curve is representing that your dose is directly proportional to your response. Now this was for the drug A. Now I have given the same patient with a drug B. Okay, so the for the curve of drug B will be such thing like that. So you have see that these two curves have distance. Now the drug A reaches at the 50% of the response at approximately 29, or you can say sorry, approximate at the 18, at the, now I have drawn the 20 here, at the 20 mg of that drug. Okay, but if you see on the drug B, it reaches its 50% of response at 30 mg. Okay, so there is the difference. The drug A reaches the 50% of response as 20 mg, but the drug B is reaches the 50% of response at the 30 mg. But at the last, both of these drug reaches at the 100% of their response. So now this will help us to find out the potency of that drug. So this 50% of the response is representing FC50. Okay, now what is FC50? We will discuss it on the next slide. So now we are going to see what is the potency of our drug. So first there is a definition of potency, that it is the measure of amount of a drug that necessary to produce a effect. कि ड्रग की वो अमाउंट, वो परसेंटेज, या वो जैसे फॉर एग्जांपल 50 mg drug, 100 mg drug, so this is the amount of drug and this is necessary to produce the effect. Like some drugs who are 10 mg cannot produce maximum effect, cannot produce 100% response, but the drug which is at the 50 mg can produce its effect. Now we have to find what kind of amount of drug can produce effects or not. Like some drugs can produce effects at the 5 mg, but some cannot. So there is a difference in the potency of every drug. Now, how you can find the potency of a particular drug? Yes, you can find out the potency of a drug by comparing the FEC50 of two drugs. That the two drugs will be given to you and you will compare their EC50. And by comparing EC50, you can find out your potency. One thing you have to remember, that FC50 is inversely proportional to your potency. The drug with more FC50 will have low potency. Now I am going to draw a curve between the response and log dose. So whenever the curve made between the response and log dose, it will be in the form of sigmoid shape. Now I am drawing the graph here for the drug A again. So it will be in this shape, and for the drug B it will be in this shape. So the first curve is for A drug and second is for B drug. Now what is going to be happen again, here is the 50% response. Now the drug A has given 50% response at this concentration, and the drug B has given a 50% of response at this concentration. Let's suppose this is the 20 mg and it has given the response at the 30 mg. Now the drug which is giving you a response at the 50 degrees Celsius, this is EC50, mean the amount of the drug which is showing your 50% of the response. So what is EC50? It is the concentration of drug that is showing 50% of response. So as you can see here, for the drug A, EC50 is at the 20 mg, but for the drug B, EC50 is at the 30 mg. So we have said that EC50 for the drug A is less than the EC50 for the drug B. So now the drug who has low EC50 has high potency. High potency. So it's mean your drug A has high potency and your drug B has low potency. So now understand it with the help of example. So now I have given the name of these drug, like your drug A is candidastrin and your drug E is arbistran. So these are the two drugs, they are the antihypertensive drugs. Now and the dose for the Candistran is 4 to 32 mg. Okay, so this is the EC50 for that drug. Now the Arbistan drug EC50 is from 75 to 300. So you know its EC50 is low, its EC50 is low, and its EC50 is higher. So the drug which has low EC50 has high potency. So candrastin has high potency, mean P, and this has low potency. So this is about the potency of that drug. Now we have also said that the graded dose response curve is also giving information about the efficacy. Now let's discuss what is efficacy. So here the definition of efficacy is written that efficacy is the magnitude of the response. In the potency, we are giving a relation with the concentration of drug. So you say that this drug is higher potency, mean it is of 500 mg, and this drug is low potency because it is 50 mg. So we are actually dealing with the concentration of that drug. So whenever you have to remember it, that potency is related with the concentration, with the amount of drug which is producing the 50% response. Efficacy is related with the response which is produced by a drug. It has no relation with the concentration of your drug. Okay, so these terms are very confusing and they confuse you. So therefore I am also giving you hint to remember them. So always when the potency is given, so it's mean it is indicating the concentration of drug that is producing the effect, and at the EC50 you will get 50% of your response. But now we are going to see efficacy. We are dealing only with the response, not the concentration of a drug. Okay, so your efficacy is depending upon your DR complex. What are DR complex? Drug receptor complex. So more the drug receptor complex form, more will be the efficacy, more will be the response. So it's mean it has direct relation. And second, it is depending upon the intrinsic ability. What is mean by intrinsic ability? It is the ability of your drug to show the cellular response, to show the you to show, to bind with the receptor and to show the response. So this is called as intrinsic activity. So more with the intrinsic activity, more will be the um, your efficacy. Now what is Emax? Okay, so Emax is the maximum dose. Here is the Emax. It is maximum response. Maximum response कितना होगा? 100%, which is shown by a drug, which is shown by a drug. So what is EC50? It is a concentration of drug at 50% of response. But it is the maximum response of 100% shown by our drug. Okay. So now let's suppose that your drug is going and have this. So it's mean at this concentration it has Emax. At this concentration it has Emax, it has 100% of its response. Okay, so this is called efficacy. Now let's discuss about the efficacy of your agonist drug and the efficacy of your antagonist. So actually your agonist drug has 100% efficacy, means it is occupying all the receptors and it is uh, producing 100% of its response. But in the case of antagonist, it's occupying all the receptors, it is fulfilling all receptors are occupied. Same in the agonist, but just the difference is that it has no response. The response is zero, and because your efficacy is all about the response, so if the response is zero, it's mean the efficacy is zero. So therefore, the efficacy of your antagonist is zero. So this was all about the efficacy. We will also study a relationship between the potency and the efficacy. So and let go and see what is the relation between the potency and the efficacy. So here I am going to show the relationship between a potency and efficacy. So let's suppose I am going to draw three drugs here. So this is the curve for the drug number 1 or drug number A, or this is the curve for drug B, and this is the curve for drug C. See, this is for C, this is for B, and this is for A. This is the 50% of the response, and this is the 100% of response. So your A and B both are showing 100% response, but your C 100% response is at the 75, okay? And your A B 50% response is here at this concentration, but your C 50% is at this point, okay? Now I am writing the dose here. So this is, let's suppose, the 10 mg dose, this is the 20 mg, this is 30, this is 40 mg of that drug, this is 50, and this is the 60 mg of that drug. Now you clearly observe that your A is going 50% of its response at 20 mg, mean its EC50 is lowest. Then your B is showing 50% of response at 40 mg drug. It means the EC50 of drug B is more than the drug A. And your C is showing EC50 at 60 mg of drug, mean the C drug has a very high EC50, and which drug has very high EC50 has lowest potency. So it's mean your C drug has very lowest potency, your B potency, the potency of your drug B is lower than A, and your drug A has highest potency. Now let's discuss their efficacy. So the efficacy means the 100% response. So the 100% response is shown by A and B at the same level, mean the efficacy of your drug A and your drug B is same, but the efficacy of your drug C is not same, as its 100% completes here at the 75%. So it's mean that your efficacy of drug C is not equal to A and B. So what do you mean by, now I have a question for you, that the drug which has more potency is beneficial, or the drug which has more efficacy is beneficial? Yes, you are good. The drug whose efficacy is more beneficial, is more therapeutic. So let's suppose if I have drawn the B as here. So B efficacy is completed here. So it's mean the efficacy of drug A is highest. So it's mean the efficacy that the A drug is more efficacy. It's mean that A drug is more beneficial if you give this drug to the patients. So this was the relation between a potency and efficacy. Now let's discuss about the effect of concentration of your drug on the receptor binding. So here the effect of drug concentration and receptor binding is given, that there is directly relation. As the drug concentration increase, the receptor binding increase. According to now you are going to apply the law of mass action. So your drug plus receptor, they are combining and making the drug receptor complex. Now ki is the association constant and kd is the association constant. So kd is converting your dr complex again into the inactivated form. So this is the activated form of your receptor, this is the inactivated form of your receptor. So kd is converting them, reversing them. Now here the formula is applied according to law of mass action. So here the dr is equal to concentration of bounded drug, the drugs which are bounded to your receptors. RT is the total number of receptors which are given to you. D is the concentration of drug, and KD is the dissociation constant, which is this. Now your kd is indirectly proportional to your dr, means your kd, when a drug whose kd increases, it means your dr is more and more converting into this form. It's mean your dr concentration decreases, so therefore they have indirect relationship. But the kd is indirectly related to affinity, is indirectly related to affinity of your drug. What is the affinity? Affinity is the tendency to bind to the receptor, कि एक ड्रग की कितनी कैपेसिटी है कि वो कितना रिसेप्टर के साथ कितनी जल्दी बाइंड कर सकता है. वो ड्रग जो जल्दी बाइंड कर सकता है, it has more affinity, and the drug which has low tendency to bind with the receptor, it has low affinity. So whenever the KD increases, the affinity of drug decreases because the DR decreases itself. Now whenever you are going to increase the drug concentration, now we are going to see effect of drug concentration or receptor binding. So whenever you are increasing the dose, the concentration of your drug, the ratio between the DR and RT, DR is bounded drug and RT is total receptor, so this ratio will becomes 1. It's mean whenever the concentration increases, the response of that drug increases out. So here I'm going to draw a graph between the DRT and the dose. For now, let's see that the first, the graph is obtained at this. So this is showing when your dose is increases, this ratio is increasing out and the response is increases. For the log dose, always you are going to make a sigmoid graph, and the sigmoid graph obtained like that. So it is also representing that whenever you are increasing the dose, this equation, this ratio increases, and as a result your response is going to be increased. Now this was all about the graded dose response relationship. Now we are moving toward the quantal dose relationship. So here I have written the quantal dose relationship. So this relationship is between the dose of your drug and the population of patient that respond to that drug. So let's suppose you have given a drug to a whole population, to a whole community, and after that you are going to observe the particular kind of action which is produced after giving that drug. So this is the response is produced. Now the all of the responses which are produces in a population, these responses are called as quantal responses. So here what are the quantal responses? So definition is written here: to see the response to a particular dose of drug in a population, कि अगर आप देख रहे हैं कि एक population में एक drug कितना respond कर रहा है एक पार्टिकुलर डोज, यानी आपने एक 20 mg की एक ड्रग है और वो आपने एक पूरी पॉपुलेशन को दिया, और उस पॉपुलेशन में काफ़ी सारे आदमी हैं और आप हर किसी में उसका रिएक्शन देखने वाले हैं, तो इस तरह के रिस्पॉन्सेस को हम क्वांटल कहते हैं, यानी आपने बहुत सारे लोगों का रिस्पॉन्स देखा है. तो अब ये क्वांटल रिस्पॉन्सेस दो तरह के हैं. एक होता है पॉजिटिव रिस्पॉन्स आना, यानी पॉजिटिव रिस्पॉन्स इट्स मीन कि अच्छा रिस्पॉन्स आया है, और एक है नेगेटिव रिस्पॉन्स मीन देयर इज़ नो गुड रिस्पॉन्स. लेट्स सपोज कि मैं इनकी जो कंसंट्रेशन है वो भी डिसाइड कर लेती हूँ कि अगर मैंने देखा कि एक पॉजिटिव रिस्पॉन्स आ रहा है, और वो पॉजिटिव रिस्पॉन्स कब आया, जब मैंने वही ड्रग 50 mg में दी, और अगर मैं वही ड्रग 100 mg में दे रही हूँ तो उसका नेगेटिव रिस्पॉन्स आ रहा है. लेट्स सपोज कि हमने एटिनोल ड्रग जो है, ये एक एंटी हाइपरटेंसिव ड्रग है विच इज़ द बीटा ब्लॉकर ड्रग. So I have give this drugs to the patient. The half of the patient take 50 mg of that drug, and half of the population of patient take 100 mg of that drug. So in the patient who take 50 mg of that drug, their BP decrease only for the 15 mg, oh sorry 5 mg. क्योंकि लेट्स सपोज कि अगर पहले उनका बीपी हमारे पास 130 था, सो 130 का सिर्फ 5 कम हुआ, यानी 130 से उनका 125 जो है mmHg उनका ब्लड प्रेशर आ गया. बट जिन पेशेंट्स को हमने 100 mg दी थी, उनका बीपी हमने देखा तो वो 15 mg कम हुआ, यानी हमने 130 से उनका देखा कि so when the 130 mg of blood pressure decreases with the 15 mg, so it will become 115 mg. So it is very severely decrease in the blood pressure, so therefore it has negative effect. So the concentration of drug which is giving you a positive response, this concentration of drug is called ED50. And the concentration of drug which is causing negative response, this concentration is called TD50. So what is ED50, what is TD, its definition is given here. So ED50 is the dose of drug that give effective response in 50% of your population. That in the 50 population of effect, you have taken a positive response, and this dose is representing that it is very good, you can give it to the patient. But TD50 is the dose of drug that give toxic effect in the 50% of population, that it is causing side effects due to its dose, due to some other actions, it is causing the toxic effects. So this concentration is caused as the toxic dose or TD50. Now every the drug which have made in the pharmaceutical industry is made under in the therapeutic index. So here the therapeutic index, so here the definition of therapeutic index is, it is the ratio between the TD50 and ED50, means you are going to compare it. So here I have draw a graph here. So here the concentration of your drug is should be remain in this therapeutic window. So this is the ideal therapeutic days on which your dose is very good, and on which you have a very good kind of drug response. So whenever you are going to decrease the dose from it, you will get toxic effect, and whenever you are going to increase the dose from this therapeutical window, you will get toxic effects. So therefore in every pharmaceutical industry, always the drug, whenever a medicine is formed, it is mentioned that it should be in the therapeutic index, because whenever it will be exceeded out or it will be limited out from this index, it will show toxic effects to you. So therefore we want more and more ED50, not TD50. We want more and more effective response, not the toxic responses. So this was all about the relationship between your dose and your response. So the management of dose is very necessary, because if you are maintaining a good dose at good purpose, then it will show you a maximum of effects, it will show you beneficial effects. But if you decrease its dose from the normal value, or if you increase the dose from the normal value, it will show you toxic effects. So this was all about the today's lecture. I hope that you will like this video, and if you like it, please press the subscribe button and like button. And I hope that this concept helps you, and if you like this video, then please share it with your friends. Make sure that you subscribe to this channel. Meet you soon in the next lecture. Till up, Allah Hafiz.